Welcome to the show, where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today, we welcome back on the show Ann Beach. She's a pediatric hospitalist. Her Kevin MD article is titled People Behaving Badly: 4 Steps to De-escalate Hostile People. Ann, welcome back to the show.
Thanks. It's nice to be here.
So for those who didn't get a chance to listen to our other episode together, just briefly share your story and journey to where you are today.
I've been a practicing pediatrician for almost 40 years. Went to school at Wake Forest, practiced small town pediatrics in Georgia for several years. In my 39-year career, I've been a small town general practice pediatrician. I've been an HMO pediatrician. I've been a hospital administrator. I've been an expert witness in child abuse and started a child abuse clinic. I've spent time creating capacity for quality improvement programs in pediatric hospitals. For the last 20 years of my practice, I've been a hospitalist in an urban tertiary care pediatric hospital.
All right. And before we talk about your article, 4 Steps to De-escalate Hostile People. So tell me some of the hostile interactions that you've had in the past that drove you to write something like this.
Mostly it's been frazzled parents who were just on their last nerve. I've certainly had a few times every year parents who yelled, who threatened, who told me exactly what I was going to do in no uncertain terms, who said they were going to have me fired, who said they were going to sue me. And it became obvious that we all need to be slick at how we handle those sorts of things. It needs to be something in our toolbox.
And during these times where you had to deal with a hostile party, someone who was threatening you, for instance, do you ever feel that you were in danger, that you were in fear for your personal safety?
I can think of one time when I thought I was going to get slugged, but I didn't. Mostly, I've just been angry that people tried to intimidate me. I believe this is an issue that happens more to women physicians than men, although it happens to all of us. And certainly it's getting worse over time. But mostly, I just got mad that somebody was trying to boss me around. And I realized that response is not productive. I worry a lot about what's happening now because it seems like it's escalating, it's getting worse, people are getting shot, terrible things are happening. And I feel for everybody who's on the front lines now.
Have you had any hostile interactions not with a patient or their family? Have you had any hostile interactions with, say, administration or your fellow physician colleagues in the past?
Oh, I can think of one physician who was pretty unreasonable, and these tactics modified a little bit, worked pretty well with doctors who were also behaving badly. But that's the minority.
All right, so let's talk about some of these techniques. And like you said, I think they come in very handy because we do live in such a polarized society, and more of these instances, unfortunately, are being encountered by healthcare professionals. So, Ann, what led you to write this article?
So I'm a writer as well as a physician, and I'm in a writers group, a shout out to the Fearless Writers, and I'm the only physician in that group. So we were meeting sometime recently when a doctor had just been shot by a patient, and they were horrified by all of that. And we were having a conversation about it, and they were amazed that aggressive patients or parents was something that doctors have to confront and have to know how to deal with. And they were shocked that people actually behave badly to doctors. So I started explaining to them how I handle this and my experience, and that's how I ended up writing the article.
So this article did gain some traction on Kevin MD, over 100 shares. What were some of the reactions to your article?
What was most interesting to me, sadly, my emergency room colleagues said, yes, this is a tool we use every day, multiple times, which made me sad and scared for my ER colleagues. I think they're the point of the spear. They're seeing the most of the frazzled, wound up, inappropriate people. So it really resonated among ER physicians. My pediatric colleagues all felt, yes, this is something they see in the office and this was helpful. I work closely with people who teach residents and they said, perfect, I need this. I actually had a colleague from another metropolitan children's hospital in Arizona who said, can I please use this? I'm teaching residents and can I use it in my slideshow pack to help teach residents? So I think it struck a nerve.
So for those who didn't get a chance to read your article, just walk my audience through it.
So imagine that you walk into a room to see a patient for the first time. I'm a hospitalist, so I think about walking in an exam room to see a child who's just been admitted and a parent, usually a dad. Imagine that they get in your face and they point their fingers and they tell you what you're going to do in no uncertain terms and they start to yell at you. So the first step is to ignore the behavior. They know they're behaving badly. It doesn't help to point it out. It doesn't help to be right. The whole point is your job is to take care of the patient. So what I say is, hello, I'm Dr. Beach. I'm the doctor who's going to be taking care of your child. I'd like to ask you some questions so I can figure out what's going on with your child. And I just try to immediately refocus to the patient. Ignore the fact that they're behaving badly. I stand very erectly. I act very professional. I happen to wear white coats and I just focus on the child. So that's step one, ignore the bad behavior. Step two, if that doesn't work, if they're still yelling, is sympathy. So most people, by the time I see them, they have been up a bunch of sleepless nights with their sick child. They may have been to several emergency rooms. They're worried. They don't know what's going on with their child. And so I say, you know, I've been doing this for a long time, and I've pretty much figured out that when people are acting angry, it's really because they're scared. And I know you're scared about what's going on with your child and you don't know what's wrong. My job is to help figure that out. So let's focus on your child. I'd like to ask you some questions and let's go ahead and do that as quickly as possible. I want to help your child. And most people at that point will say, yes, we've been to 7 doctors and nobody knows what's wrong. And they are scared. So just opening the door for them to be scared and feel vulnerable lots of times takes care of the problem. So most cases, step one and step two, handle the issue. But every once in a while, somebody is still wound up. And so you have to go to step three. So step three is what I call the teamwork step. I say, listen, your job as a parent is to do what's best for your child. And usually people go, you're damn right it is. And then I say, my job as a pediatrician is to do what's best for your child. We have the same job. It's not you against me. We are on the same team. So let's you and I work together to figure out how we can help your child. So then I press on with taking the history. Usually that works. Small percent of the time, people are still unreasonable. They're still yelling. And all of this is just taken 30 seconds, 45 seconds. It's not a long process. But if they're still acting scary, acting unreasonable, maybe they have a psychiatric problem. Maybe they have a drug problem. Maybe they have anger issues. I don't know. But if they still cannot be reasonable, I go, you know what? I'm going to leave this room for 5 minutes and I'm going to give you a chance to calm down. When I come back in 5 minutes, I'm going to treat you with a great deal of respect. You, sir, are going to treat me with a great deal of respect. That is what we do at this hospital. If you're not able to treat me with respect, I will call security and have them remove you so that I can take care of your child. And then no matter what they say, I leave. But sometimes people go, okay, I'm going to calm down. I leave anyway. I call security, I put them on standby, I go do something else for 5 minutes. And then I come back. I would say about half the time, that person is no longer in the room. They've gone. And my guess is that whoever the other adult is in the room kicked them out and said, you're just being a jerk, you leave. I don't mention it. I don't talk about anything that went on. I just take care of the child. Sometimes when I go back in the room, that person is still in the room and they're behaving. Rarely I go back in the room and they're not behaving. And then I have security on standby. They come and escort them out of the facility. And so that's my 4 steps. Ignore the behavior, be sympathetic, talk about teamwork, treat them with respect, and get security involved. And that is fairly quick and works pretty well.
How did you come up with these steps? Is this someone that taught it to you? Is this something that you learned
No,
through years of experience? How did you come up with it?
trial and error. And everybody has their own style, but this is what over the years I've ended up doing. And this is what I teach residents, because the first time you walk into the room with a resident or a medical student and a parent goes ballistic, the residents' eyes get this big and they don't know what to do, but they need to have it in their toolkit. They need to know what to do. So again, I think it's just trial and error. But to me, the big thing is it's really hard to be a parent of a sick child. It is really hard to be a sick patient. And those of us in healthcare who've been there know it, but a lot of us haven't been there. And if you can just emphasize the sympathy, yes, you're sleep deprived. Yes, you're frazzled. Yes, I know you're really worried. I want to help you. And that's the direction I want to go in. It never helps to go in the direction of, look, I'm the boss here, or I know way more than you do, or you just need to behave yourself. None of that ever works.
Now I want to talk about the primary care setting and see whether we can use some of these techniques in a typical, say, primary care setting. I do primary care, and I'm sure a lot of pediatricians, they see children and their families who get a lot of misinformation from, say, social media, and a lot of these patients and their families, they're openly challenging medical professionals and openly doubting the advice that they give, and they're saying that whatever they read or heard from their friends, that's what they should do, and they should be demanding that their pediatricians also do that as well. Now, let's say in that typical setting where that patient or the family is steeped in misinformation, what are some ways we can use some of your techniques to help address something like this?
So a large part of my practice was before Google. And so I would say about half my practice has been since Google, and it's been radically different. When I get the idea that I'm going to get a laundry list of, here are the tests I want because I read this on Google, I try to be extra nice, and I try to disarm them with humor. I very often will say, have you had a chance to scare yourself with Dr. Google yet? Have you got your list of what you think I might be doing? Just to say, I know everybody's reading Google, and I know you probably scared yourself. And on the occasion that people have a list, or we need an MRI, I sit down and just start at the beginning and go, okay, maybe you do, but I got some questions I have to ask first. And ask all the questions I was going to ask anyway. I try to back up a few steps from the I need, I want, to ask more questions. I do a lot of thinking out loud. My style is just to say, let me just tell you how doctors think. We make a mental list of all the things that could possibly be going on, and then we ask questions, we do physical exam, we do tests, and one by one, we're able to knock things off the list. So I'm going to start out by asking you a bunch of questions so I can make my mental list. Nobody has any idea how we think or what a differential diagnosis is. So I just try to be very open and very conversational and upfront.
Now, what about scenarios where patients and their families bring up things that are actively harmful, refusing vaccines, for instance?
Sure. I had years of that. In my private practice, now this will be controversial, but in my private practice, if people refused vaccines, I just always said, listen, I'll be your pediatrician for the next 2 weeks, give you a chance to find another pediatrician, because that is not the kind of pediatrics I practice. And they would go, oh, we really like you. I go, you know what? This is Pediatrics 101. If you can't trust me on Pediatrics 101, we're not going to have a good trust relationship if something really difficult comes up. So you need to find somebody you can trust. It's not me. I've had parents who I knew their child had meningitis and they refused a spinal tap. And I tell them how very worried I am, how very scared I know they are, how crucial this test is, and how the law allows me to take custody of their child if I feel like their child's life is in danger. I've done that a few times. Meningitis, kid needed a spinal tap. I had a newborn baby with hemolysis and needed a blood exchange transfusion, and they were Jehovah's Witnesses and were not consenting to that. So I got a quick judge order for consent, those sorts of things. And certainly I've taken care of lots of children who have been physically abused. And so you have those issues as well.
We're talking to Ann Beach. She's a pediatric hospitalist, and we're talking about her Kevin MD article, People Behaving Badly, 4 Steps to De-escalate Hostile People. Ann, what are some of your take-home messages that you want to leave with the Kevin MD audience?
First of all, be really sympathetic. Try really hard to understand where people are coming from. Second, don't let yourself be abused. Have a plan. Know what you're going to do with the unruly or scary patient. Practice it. Be ready to execute it.
And thank you so much for sharing your time and insight. Thanks again for being on the show.
Thank you.